Welcome, everybody, to my podcast, Senior for Seniors, where I dive into the stories of seniors, explore their unique experiences, discuss the real issues facing seniors today, and introduce you to those assisting seniors in their senior journey. I have the privilege to talk to some of the most interesting people in the world impacting the senior community today. My name is Jim Mazziotti, and I'm a realtor. I've been a realtor for 34 years. I'm a national speaker, real estate coach, and an author. And my goal today is to give you information that you can use and that will benefit you in your senior journey. And today, my guest coming to us from Chicago, Illinois, is Matt McCann. And Matt McCann is recognized as one of the nation's leading long-term healthcare specialists and a nationally known speaker on long-term issues. He is also the publisher of LTC News, the leading consumer-focused website providing information, tools, and resources on aging, caregiving, health, long-term care, and retirement planning. Matt, thank you from a very cold Chicago, Illinois.
Well, thank you, Jim. I got to complain here. You didn't tell me I had to be interesting.
Well,
You
it
said
just
the
goes,
most interesting people. I'm not sure I'm very interesting, but I will
you're gonna
do my best.
you're gonna try, huh?
I will do my best. Absolutely. It is cold as we speak. It's like 3 below 0, and that's not the wind chill. That is the air temperature.
Yeah, so it's even colder when you go out into the streets of Chicago.
Absolutely.
Yeah, you're going to be shaken. Hopefully, there'll be some listeners to this podcast that listen to it in down here, maybe in Texas in July or August when it's 108 degrees, and maybe feel just a little bit better knowing that there is hope for the future with winter coming, huh? Uh,
Absolutely. There you go.
well, Matt, you're an expert in long-term healthcare and planning. Tell me a little bit about what you do for those of us who may not know what exactly do you do in long-term care and in your business?
Well, I've got two businesses that I run, and while they are related, so to speak, they are completely different. I am a long-term care insurance specialist. I've been doing that since the late 1990s. I am licensed in every state and the District of Columbia. I help individuals plan for the future costs and burdens of aging. As you probably know, Jim, and maybe some of your listeners do as well, health insurance and, of course, Medicare once you're 65 and any Medicare supplement you might consider only covers skilled care, and that's only for a short period of time.
Right.
So most long-term health care costs are, without long-term care insurance, paid either out of pocket or family, adult children step in. So that's why people get long-term care insurance. And obviously, since I've been doing this for so many years with so many clients, I now go through the claims process all the time. So I actually see how these products actually work and benefit families after the sale, so to speak.
Right.
Several years ago, I felt that there was a need for a comprehensive internet resource that talks about aging, caregiving, health issues, lifestyle, long-term care, and retirement planning. And that's when we put on LTC News. It has a large staff now of writers and people who support the website. And its goal is to provide tools and resources to help people in two areas, either in their attempt to plan for their future retirement and future aging needs, and to help those families already in crisis.
Yeah.
And what I mean by in crisis is they have a loved one, usually a mom or dad, that need long-term care. And now, what do they do? If there is no plan in place, where do they go from there? LTC News has the largest database of caregivers and long-term care facilities in the country. We've got over 80,000 providers nationwide that you can easily search based on city, town, zip code, what have you. So that's what I do. Obviously, it's related to aging and long-term care, but they're totally different types of jobs, so to speak, that keep me busy day and night.
Well, I've seen your newsletter, and how do people go there? Just so we get that, so I don't
The,
forget to
the,
ask.
the website for LTC News is ltcnews.com.
That's about as simple as it goes. I'll be sure that I put it in the show notes so anybody that
Absolutely.
missed that knows that. So one of the things, being kind of a knucklehead, is that I'm realizing that I'm 70 years old, and both my wife and I are currently healthy, but that can change while we're having this podcast, right? I mean, things happen very quickly. It seems to me that the message of long-term health care and the need for it and the planning for it is not done by most people. Am I right? Because I
Well,
never thought of.
you're absolutely right, and that's a problem. That's a problem that the federal and state governments across the country have been dealing with for a number of years. Um, the biggest reason people don't plan for long-term care is denial. It's not the cost of insurance.
It's not going to happen to me, right?
It's just not going to happen to me.
Hmm.
I'm thinking, hey, it's not going to happen to me, but that Jim guy, man,
Yeah.
it's going to happen to him. Meanwhile, Jim is saying, it's not going to happen to me. It's going to happen to this mad guy.
Uh-huh.
And that's the problem today. People are very aware of aging and long-term care, more so today than at any other time in history, where longevity has created not just a crisis in the United States, but globally as well. But the problem becomes on an individual basis, this wall of denial. And you kind of said it yourself just a couple minutes ago. Both my wife and I are healthy. You didn't finish the sentence, but I know what you were thinking. I don't need care. I don't need to be thinking about this. Oh, sure, something could happen. But obviously, you're 70 some years old and you haven't done anything about it. And this is something you typically want to do in your 40s or 50s as part of retirement planning. Because by the time you get in your upper 60s, 70s, and beyond, many of us already have chronic health issues that make it more difficult to insure, or in some cases, impossible to insure.
Hmm.
And premiums for long-term care insurance are based on age at the time you get a policy and your health. So you can't buy a policy once the crisis has occurred. At that point, it's already too late. You have to do it ahead of time. And you want to avoid the crisis. And that's why, obviously, planning sooner than later is going to be beneficial, not just for you, but your family as well.
Sure.
And I think that's where the biggest thing that people should focus on. You're going to get the care one way or the other. Somehow,
Hmm.
your daughter-in-law, somebody will take care of you, or they're going to drain your assets, and then
Sure.
maybe you end up going on Medicaid,
Hmm.
uh, which is the medical welfare program.
Sure.
But you're going to be taken care of somehow. Now, the quality of care may be somewhat questionable, but you're going to get your care taken care of. Impact is on your spouse, who may live on another 10, 15 years after that crisis event occurs, and the rest of your family. Adult children, who often someone says, oh, my daughter can take care of me, or my daughter-in-law. How's that going to work? Do
Hmm.
they have a job? Do they have a spouse? Do they have children? Do they have other responsibilities? When are they going to do that?
Yeah, exactly.
Juggling caregiving with the rest of your life is pretty challenging, if not almost impossible.
Yeah. Yeah. And, I know that in my personal situation, both of my parents were diagnosed with terminal lung cancer with 6 months to live at the same time within a week of each other.
Oh,
And, and they had no planning. Again, nothing was going to happen to them, right? And
right.
the plan, and so I saw it. I saw the whole thing. But it seems like in my life, I always put it off because I was too busy trying to make a living than to think about what was going to happen in my future. And and now that I'm working with seniors, primarily with seniors, trying to help seniors, I've come to this realization late in the game. But how can we better help the seniors right now that are in their 70s and 80s? And my thought was, not to answer my own question, was hoping that if they see this, they would have their children watch this, maybe help their children realize that in their 40s and 50s, maybe now's the time that they start planning before they have diabetes or whatever could happen before it's too late. How could people like me better get the word out to people?
Well, first off, just because you're in your 70s or maybe even early 80s doesn't mean there shouldn't be planning. So let's start with, what do I mean by planning? First off is conversation. Forget insurance at the moment. It's conversation.
Mm-hmm.
If you have not had a conversation with your adult children about aging and what your preferences are, what your concerns are, where is the money? Those types of conversations. You need to do that. I'll give you to tomorrow.
Mm-hmm.
Okay.
Mm-hmm.
You make arrangements tomorrow to do that. And there are some people who hesitate that because that's none of their business.
Yeah, yeah, it's difficult. It's just a difficult conversation.
And so is it really that is your concern, or is it the discussion of something you'd rather not want to talk about? Now, I think for some people, uh, they are private people. They don't share what their health is with anyone, much less their family. And you got to get over that. Uh, it's not and should not be embarrassing to say, yeah, I got diagnosed with diabetes when I was 64. My A1C now is 7.3. I take 1,000 milligrams of metformin, blah, 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 blah. You know what? We're human. Things happen. We're machines. And machines break down unless you take care of them. And even if you take care of them, we still age and break down. So you shouldn't be embarrassed. And your adult children aren't going to feel weird because you have diabetes or you had a TIA or maybe you got diagnosed with early Parkinson's and no one knows. Uh, those are conversations that need to happen. Your families need to understand, hey, this is how we're planned our retirement. Here's where the money is. You don't have to necessarily give them every amount, but give them
Sure.
an idea. We got a couple of 401ks set aside now, rolled into IRAs, and we got this piece of property that we rent over here, and all the information's in a drawer next to the refrigerator, whatever.
Mm-hmm. Mm-hmm.
You don't necessarily have to show all the cards, but you can't have them go in blind when the crisis occurs. And so you have to have that difficult conversation. And then the second part of that, and by the way, that conversation ideally should have happened when you were 55, if not
Right.
50.
Mm-hmm.
But you need to have that difficult conversation. And then you need to share what your preference is. I don't want to be in a nursing home. Okay, well, everyone says that. Who wants to be in a nursing home? Nobody. But most long-term care, if you happen to need care, is not in a nursing home. You've got a variety of home care options from professional caregivers or home health agencies. There's adult daycare, there's assisted living, there's senior communities. There's tons of these senior communities that may have common eating areas. It's primarily independent living,
Mm-hmm.
but they're built in a community that's much more safe and has a community where if something happens, you can press a button and someone's going to come. It's not where you're going to receive care, but that is an option for some people when they want to downsize and be around people that are their own age.
Sure. Yeah.
And then, of course, you have the formal assisted living, memory care. Obviously, there was a story recently that the amount of people with dementia is going to more than double by 2060. That's scary.
Scary. Terrible.
And dementia is primarily a result of longevity. It's not like there's a virus out there creating dementia.
Hmm.
Um, so it's kind of the good news, bad news. Good news is you're probably going to live a long time. Bad news is you're probably going to live a long time.
Hmm.
And how are you going to deal with those obstacles that are going to be along the way? So that conversation should occur. Now, if you're in reasonably good health, meaning you're independent, you don't have dementia, there may be insurance options up to maybe even 84 years old, 85 years old. Keep in mind that they may not be suitable for you because the cost may be a little bit higher than if you did it at, 55. But you should see if you can qualify for something,
Hmm.
assuming, of course, you have assets to protect. Now, for listeners that have little or no assets, then insurance is not appropriate.
Yeah.
Medicaid is there. The problem, of course, with Medicaid, you have to use Medicaid providers. You have to have limited financial resources. Your choices are more limited, but you do have something. But you still need to have that conversation with the family. That's first and foremost before anything else. And of
And
course, second part of that is, share
go
this
ahead.
with your kids so they plan.
Yeah. Well, and I think, there's the reality has hit a lot of people, especially from Thanksgiving and over Christmas. That's where, a lot of kids will come home that don't see their parents on a regular schedule, maybe only see them once a year, and they go into the house and there are things to look for, right? To see, are there are there signs that, I mom and dad are failing and we need to think about what is next. Of course, we're talking what we need to do before then. But this is the reality. A lot of people, and I don't know how many of the viewers to this podcast and listeners will go, oh my God, I just had that experience. I just went home for Christmas and dad is failing. He can't walk, or he walks, and has to catch himself and hold himself up. And so, it's a real issue. It's such a huge issue. And tell me the difference so the listeners, viewers are clear on this, Matt, the difference between Medicare and Medicaid, just so we're clear. You kind of have mentioned it a little bit, but I don't think a lot of people know the difference until this kind of thing happens.
Absolutely. So it's the last few letters of the word that give you the clue. Medicare, care is health insurance. We pay taxes for Medicare our entire lives. That becomes our primary health insurance when we're 65. Medicaid, aid, is the medical welfare program. So you have to have limited financial resources. Medicaid is the number one payer of long-term health care in the United States. And age has nothing to do with Medicaid. You could be 35 on Medicaid because it covers regular health care as well as long-term care. And of course, you could need long-term care at any age. The youngest client I had go on claim was 27.
Sure.
So while we think of long-term care as being something that happens when we're older, the advances in medical science make it difficult to die, and that has increased the number of people at all ages that need long-term care. But to piggyback on what you were just saying about the holidays, the biggest time for long-term care insurance claims is right after the holidays for the exact reason that you just mentioned. And you visit mom and dad, and if they don't live as close to you as you want, you only see them at Thanksgiving, Christmas, Hanukkah, etc. That's when you notice those things. And the furniture surfing. Ever
Hmm.
hear of furniture surfing? And on the phone, they may sound absolutely fine. But you go in the house and you see that things aren't right. And it could be a lot of different signs, including recently a daughter of one of my insurance clients called and wanted to start a claim because her mom's electricity was turned off. So she went over there and found that she wasn't paying bills. The reason she wasn't paying bills is because her mom was writing the check, putting it in the envelope, putting the stamp on it, and then putting it into the sink where she thought that was the mailbox.
Yeah.
So bills that were not automatically drafted weren't getting paid.
Terrible.
Mom thought she was paying them. So it's these types of things that happen, and mom and dad, especially if they're older, may not share with their adult children some of those concerns.
Hmm.
So, and not everyone has the ability to visit mom and dad on a regular basis, especially since so many people live apart.
Sure. Yeah.
But video chats have become a really key thing now. And I have a mother-in-law who is 89 years old, and she has her smartphone, okay? And she can do
Hmm.
video chats, and you can
Hmm.
see how she's doing, and more importantly, see what's behind her.
Right.
Is there stuff on all over the floor? Maybe there's a bruise on their arm. So that's something that whether you're the adult child of a senior parent or you're a senior parent talking to your adult children, just don't talk to them on the phone.
Yeah.
Use everyone now, including older adults, have these little devices.
Yeah.
Use them, do the FaceTime, and encourage, if you're the adult child, encourage your mom and dad to kind of show you, hey, what'd you do with your kitchen lately? Go in the kitchen, let me see.
Hmm.
I mean, you put it in a way where
Yeah.
maybe they're not so suspicious. And of course, if you're the older adult listening to this webcast and the internet, and now you know what they're doing, that's okay. The reason is you gotta be transparent because I'll give you an example. Falls are one of the biggest reasons seniors go to the emergency room.
Right.
Falls are one of the biggest reasons for long-term care. Falls are also one of the biggest reasons for death. And for whatever reason, older adults love to clutter the floors with those throw rugs, the most
Oh God.
dangerous pieces of things that you can put in a house. Get rid of the throw rugs. They're not necessary. Pick
Yeah.
them up, toss them. I
I re
don't understand.
I remember that conversation, my parents with my grandmother, and she would have in every doorway, she would have a throw rug. And it was constantly, and I got this fall risk. I had this when I was in the hospital recently. It was kind of mortifying, that I had to wear a fall risk thing. But it's true. It's dangerous. And, I think if you reach out to your parents, if you reach out to those uh, that you love, you're doing it because you love them, right? And I think that needs to be made clear. So tell me, what is the cost? What is the cost of long-term uh, care insurance? Tell me something that my listeners can grab onto and have a little bit of an understanding.
So cost is based on several factors: age, health, and the amount of benefits that you have in the policy. So long-term care insurance is custom designed.
Okay.
So if you read articles online or in a magazine or newspaper, you might say, well, long-term care insurance is really expensive. Well, not necessarily. The first thing to do is find out what is the cost of long-term care where you live.
Okay.
So On ltcnews.com, there is a comprehensive cost of care calculator that you can go to, and you put in your zip code, and you'll see what the cost of home care and adult daycare and assisted living and all that is. So it tells you, all right, what is the financial risk? And then you're going to look at, well, I've got Social Security coming in, I've got this pension, I've got earnings off this investment. Um, what is the cash flow problem that I am going to need in order to ensure quality care, maintain lifestyle, and not blow through all my assets? So you don't have to necessarily insure for the entire cost of care. The average cost of care where you are is, let's say, $6,000 a month. You don't necessarily need a policy that pays $6,000 a month. But you're going to have some income coming in, okay?
Yeah. Yeah.
And keep in mind, most care is at home and assisted living, not in a nursing home. Nursing home costs are obviously the most expensive. So since that is not where you're probably going to be, don't insure against this unlikely event. You insure against the most likely event. And if you happen to be in a nursing home, well, you're not going to have your house. It's going to be sold. Those expenses disappear. So some of the extra cost becomes a wash. You can get policies for anywhere from $120 a month on up, depending on your age and all those other factors. So if you have savings and you have income, it's probably very affordable. Now, if you're 75 trying to do it, it's going to be more expensive. It's going to be $300, $400, $500 a month. But again, you talk to a long-term care insurance specialist. There's a link on LTC News to find one near you to get accurate quotes and all that. And make sure that the person that you talk to is a actual specialist in long-term care insurance. That is not usually your financial advisor. They should represent all the top companies that offer long-term care solutions. That way they can determine.
Let me interrupt you. So I would think that if you have a financial advisor, that he should guide me to people like you, right?
They don't. 99% of the time, they try to do it themselves. And they may represent one company, maybe two, and they don't know anything about long-term care. So they recommend stuff that's way too expensive, and the client says, I can't afford it. And that's the end of the discussion. So financial advisors are one of the biggest reasons there is a crisis in the United States in long-term care. And
that's why I have you here, right?
Yeah.
Okay, that's why I have you here. So
yeah, don't ask me about mutual funds. I don't know about that. Okay, I have a financial advisor to help me with mutual funds and stocks and retirement planning. Okay.
Yeah.
But don't ask the financial advisor about long-term care. They're going to they're going to recommend something way too expensive and don't know how to design it, don't understand underwriting, and because they only represent maybe one company, they don't shop it around. And it may be that you don't even health qualify or it's not suitable and they don't understand those things. So you talk to a specialist that represents all the top companies that understands underwriting, and underwriting criteria varies somewhat dramatically between insurance company, insurance company, even on the same health issue. So company A might be less expensive for most people, but if you have diabetes, it's not. And then it's company B or company C. And that's why it's important to talk to a specialist who can kind of find out more about you in terms of both health and finances in order to make the proper recommendations. So you have something specific and accurate to think about.
And I think you told the listeners and me that you're licensed in all 50 states. Is that correct?
I am, yes.
Yeah. Okay.
And if you're interested in talking to me, you can go to radioltc.com. That's radioltc.com. That way you don't have to try to, that'll take you right directly to my website, so you don't have to, try to spell McCann, MCCANN. And there's a lot of different C's and A's and N's in there. And this is, not Wheel of Fortune. So the best way, just radioltc.com, and that gets to me if you'd like to talk to me.
So what question haven't I asked you that I should have asked you? That my listeners, those watching on YouTube, what haven't I asked that I should have asked, Matt?
You did a good job at asking a lot of the important questions, except maybe, um, perhaps the reasons people don't need to plan. What are those reasons? So let's talk about some of the reasons why you may not need, everyone needs a plan, but not everyone needs long-term care insurance.
Okay.
So there's
All
the
right.
obvious, you don't have savings and investments. Okay. Buying insurance is not appropriate. Having a plan is important. You still have that discussion with family, but buying insurance is not. The other area people will sometimes say, well, Matt, I got plenty of money. I can, well, they say self-insure. You're not going to self-insure. You may self-fund. You're not going to self-insure.
Right.
So how much money do you need to self-fund? Well, when will you need care? How long will it last? And how much will it cost? Do you have the answers for that?
Yeah, nobody knows that.
No, you don't know that because it could happen when you're 57. It could happen when you're 97. You could be like Ronald Reagan and be extremely healthy, but otherwise lights are out and
Mhm.
live 9, 10, 11 years in care because of Alzheimer's. We don't have those answers. So even if you had millions, is that money just sitting under the mattress? Probably not. Hopefully not. If it is, let me know what your address is and I'll come by and make sure I sweep under there. But it's in stocks, it's in bonds, it's in accounts, it's invested. So we don't know when you'll need care. We don't know what the markets are doing. So, for example, in the '08 crash, it was October, just before the presidential election. Okay? Market crashed. If you needed care then and went to sell your IRA, your 401k, you'd be selling at a huge loss.
Right.
Remember, a loss is only a loss when what happens? When you sell it.
Mhm.
Otherwise, a loss is just on paper.
Mhm.
Okay. Stocks go up and down. I'm rich today and not so rich tomorrow. Oh, I'm rich today and that next day. So a loss on paper is not really a loss until you sell. So there were, unfortunately, a lot of people who had to sell assets during that period of time at a loss to pay for care. All right. Well, guess what? Their cost of care was higher because not only were they using their own money, but even though it's a loss, most losses are still capital gains because you're taxed on the tax basis of the original investment. So you
Mhm.
may have, bought the investment here, it went here, and then came down and now you sold. So it's a loss, but even at the loss, it's still a capital gain.
Of course. Right.
So, and then who's going to make the decisions as to what accounts you're going to liquidate? It's not going to be you. Your spouse, maybe? Well, what happens if she's 83 at the time?
Mhm.
Okay. It's going to be a son or daughter or a son or daughter in law. Will they make the same decisions as you would? Maybe, maybe not.
Mhm.
When they decide what care you're going to get, because they will be making the arrangements for that care, will they consider the cost of care in that process? Because now they're spending their inheritance.
Exactly.
Now, I'm not saying they're going to do anything on purpose to do anything bad, but we're human beings.
Of
In the
course.
back of your head, well, this place is okay and it's half the price. All right, well, is that the quality of care you want for mom and dad? More importantly, is that the quality of care you want for yourself?
Self. Mhm.
So when you have a plan and you have tax-free guaranteed funds to pay for that plan, you are now in control. Your
And
family can be loving and supporting as opposed to trying to deal with the crisis.
Sure.
So, and then the third part is what kind of health conditions make me uninsurable? We kind of talked about it in general, but you didn't ask the
Hmm.
question.
Hmm.
Well, that does vary with every insurance company, but let's talk first about the obvious. If you have dementia, you probably have very little options. You already need care.
Yeah.
If you already need care for any reason, you're uninsurable. Well, that's not fair, you might say.
It's life.
All right. Well, let's think about it this way. You live in California. Your house just burnt down or is burning down right now as we speak, but you didn't have insurance. And you call State Farm because you just saw one of those great TV commercials. And you calling the agent and say, "Can I get homeowners insurance?" Oh, sure. Does it matter that my house is burning down right this second? What do you think they're going to say?
Yeah, might
And I'm
have an
not picking
effect.
on State Farm, Allstate. It doesn't matter.
Right.
Nationwide, it doesn't matter what the insurance company is. With insurance, there has to be what? An if. If there is no if, it's not insurance. It's welfare.
Hmm.
Okay. Because if you're going to buy a policy and I'm going to immediately turn around and give you money, it's either welfare or I'm going to have to charge you as an insurance company more than the cost of what I'm paying you back, right?
Exactly.
So you have to do stuff before the if happens because it has to remain an if. So if you have a chronic health condition that is under control and you're remaining independent, there's a good chance you can get insurance. Okay. You mentioned diabetes earlier.
Hmm.
Unfortunately, there's a lot of people with diabetes. So what are they
Hmm.
going to ask you? What is your A1C?
Hmm.
Okay. Do you have any complications due to the diabetes? Are you on insulin or are you on the metformin or glipizide or any of those other oral medications?
Right.
So if you don't have complications, you're not on insulin, good chance if your A1C is, appropriate, usually under 7 ideally, under 8 definitely, you can probably find coverage. Okay. Family history falls into with some companies. For example, if you have two parents or two first degree relatives that have Alzheimer's or dementia or had it, some companies say, you know what? Thank you, but no thank you. We don't want you.
Hmm.
Other companies don't care. So there's a lot of different health issues out there. And my message would be don't assume, but ask. You know what happens when you assume? We
Exactly.
won't, okay, we won't
We
get
can't. Yeah,
into what exactly
we
happens,
can't
but
say it.
everyone knows the rest of that line. And you talk to a specialist, not a financial advisor, not a general insurance agent. And then the final thing I think is important is that any long-term care policy ideally should meet federal guidelines. There are a lot of products out there that get marketed by general insurance agents or financial advisors that are not long-term care insurance. They're life insurance policies with chronic illness riders that are just very expensive products that put a lot of obstacles in how you can use that death benefit for long-term care. Now, there are life insurance policies with qualified riders for long-term care. In the industry, they call those hybrid policies. And they are tax qualified long-term care policies on a life insurance chassis. Now, they're more expensive because there's a death benefit too.
Hmm.
And last time I heard, there is a 100% chance of death. That may only be a rumor. Someone can correct me. But because of that, if you're dealing with both life and death and long-term care, morbidity and morbidity, uh, then you have to pay more for that. But some
Sure.
people like the idea of having both. Again, that's a conversation with a specialist who understands federal guidelines, the tax complications and tax benefits of long-term care insurance. Let me ask you, are you familiar with the long-term care partnership program?
I'm not.
Okay. One of the biggest secrets in retirement planning, but most states have participate in the federal long-term care partnership program. What that means is if you have a qualified long-term care partnership policy, you get additional dollar for dollar asset protection, or what a state bureaucrat would refer to as asset disregard. So in the event you were to exhaust all the money in a long-term care policy, you're able to legally shelter part of your estate based on the total amount of benefits paid out by the policy and still qualify for Medicaid. In other words, no matter what happens, you would never lose everything.
Everything, right.
So even a small policy has substantial benefit. And again, unfortunately, a lot of financial advisors are completely unaware of the partnership program.
Mm-hmm.
So I think we now covered most of the big things, but listeners should first go to ltcnews.com. That gives a nice broad education, so to speak.
And there's a lot of information on there. There's a lot of information.
And then speak to a specialist, not a financial advisor, not your auto insurance person, not just some general insurance agent, but a specialist. And anyone can call themselves a specialist. Just ask, how many people have you helped last year?
Mm-hmm. Yeah. And
some top specialists will help 100, 200, 300 people a year. If it's, 12 or less, they're probably not a specialist.
Sure. Yeah. And that's exactly, what I'm trying to do, because anybody can sell real estate that has a license in the state of Texas. Anybody can, but that doesn't mean they're the best person for a senior, for example.
Right.
And so people can reach you at radioltc.com. Is that correct?
Correct.
Okay.
That way, that will forward you to my website, and all my contact information is there. Correct.
Listeners, listen, just do it. Just reach out to Matt. The reason he's here today is because he's highly recommended. He is a specialist at what he does. There's no harm, no foul. If you're not a candidate, if he can't help you, I'm sure he's professional enough to tell you that. And I would guess the other takeaway is let your kids know, if you're fortunate enough to have children, talk with your kids. Make sure they understand what's going on in your life and what your plans are. My God, if you don't have a will, get a will, but the very basic thing, right?
Yep.
But I think hopefully this podcast has helped you and will help you in the future. And Matt, I want to thank you for coming all the way from Chicago to be with me. I bet you wish you were down here where it's about 30 degrees warmer than it is in Chicago, but we'll see. We'll see you when it's about 108. Maybe you can come down this way.
I remember the days in San Antonio when I was there for several years, and my first day in San Antonio was July of 1993. I think it was 101 degrees, and it's like, what did I do? But,
yeah. Well, I feel like that at times. So, Matt, hang on. Everybody, I want to thank you for being here, and I'll see you the next time on Senior to Seniors.